Hello everyone. Today I'm going to explain about the Part B OET rating, which is very important and it's quite difficult for many students. So Part B, what I can tell you all is that Part B rating is a paraphrasing one, and it has a certain question. Different types of question are there, which I'm going to explain you today. And when you are reading the Part B, I'd like to tell you is please try to concentrate and try to take the meaning of the question, some of the vocabs which may be unfamiliar in the questionnaire. When you are getting such unfamiliar from the question, please try to take the note and try to get the meaning or as well as synonyms at the earliest. Why I'm telling this thing is because in a part B, you may get the repeatedly this kind of question in the exam as well. So if you know the meaning in the question, then you may not end up with a trouble in your exam. You will get the answer easily from the text. But from the text, this text, right? If you're reading this text and you may end up with not getting the meaning, don't worry so much because English is vast and you may not end up with the trouble when you don't know the meaning from this section. But if the questioner as well as the option, if the meanings are unfamiliar to you, word are unfamiliar as well, so you need to take down the meaning. And I have also published about the vocabs which is commonly found in the reading. So please look into that as well as you can take yourself when you are experiencing as well as while you are reading. So I'm going to explain you how to tackle in the Part B reading. In the OET rating, first thing is paraphrasing. You all are familiar with the paraphrasing. If you don't know, I will explain as well. So paraphrasing means it's a kind of the vocabs. It's a meaning that some kind of vocabs will be here. Close proximity is a similar meaning. We can say nearby. So close proximity, if you don't know this meaning, you may end up with losing the marks in this text, in this question one. In the OET, if you don't know the meaning, don't worry, but all time try to take the maximum meaning from the reading experience you did during your practice time. If you are not doing these all things and how many times you are practicing, this will go in vain. So I like to advise all of you to take the maximum vocabs which you are getting during the practice as well as practice over and over again and try to recall the meaning of this word. Likewise here, close proximity, take down note and write the meaning near. If you write in this one, you will get the good score in reading section. So likewise here, I'm going to explain now part B. In a part B, there are 6 questions which you will be getting in the exam. If you are able to get 6 out of 6 and the reading part A, you get a 20 out of 20, you will get 26, and then only the part C, there are again some more questions are there. You need to answer correctly with a few questions only. So there is a less pressure. That is a way to tackle with the OET rating. So I will explain you how to tackle with the OET rating part B. This I have 3 questions here in my video, which I'm going to teach you. Again, if I get the free time, I will teach you with a more rating pattern. There are individual different types of technique as well as different types of scenario, different types of vocabs you may experience while during the practice time. So I will teach you some of the vocabs which I'm going to see in this text and the two more texts below. So part B section, there are 3 options and there are 2 different types of question. This is the sentence completion text and well, this is the questionnaire. This is a questionnaire text. If you're getting the questionnaire text, you need to search the answer from here. If you're getting the sentence completion questionnaire task, you need to get the completion sentence from the text. So now first how you should tackle in the OET rating part B is you should read this question for sure. You need to read this question for sure. Not only that, you need to read the option. But what I found from the many of the tutors is that they are telling the students to take the text to read the text first, then go for the option. In my opinion, I have seen with the many students as well, when they were doing this kind of tips, they end up with losing the connection while reading, and when they come up, they see the different types of sentence. Different types of statements will lead to the confusion that I have felt among the students. So I like to recommend or advise my friends that you try to take the uh, option first, try to read and paraphrase yourself and keep in your mind while you are going through this test. No need to read all as well. Some tutors again they will say no need to read all. In my opinion also I don't read much. I just go with the superficial reading and then I get all the answer. So likewise here in my case what I will do is Manual, the manual informed us that blood pressure monitoring. This is a blood pressure monitoring question. So there are three options. So you got the maximum 2 minutes in the part B. If you are giving the 2 minute, that is also too much. Try to finish within the 2 minutes and try to get jump to the next when you are not able to get the answer. But I will teach you the technique then you read the part A, B, C. Is likely. Likely is again kind of the distraction. So try to just put the line. Put the line is likely to interfere with the operation. Operation medical equipments. This is again some kind to think over. When you are keeping the mind this way, there are varieties of the option the examiner will provide during your exam times. So second is may not. Again, this is a distractor. So all the distractor you should know. This is likely or maybe. These are similar. May not is a negative answer. May not work properly, correctly in close proximity. This is near. Again, this meaning if you don't know, jot down near to some other device may not work. It does not work with a close proximity to some devices. And number C is should be considered safe to use in hospital environment. So it is talking about should be considered safe to use in all the hospital environment. It is talking about all the hospital environment, no, all the hospital environment and consider safe to use. Using mean you may forget all hospital use. Okay, these two words should be there in this text. Otherwise, it should be negative answer with the near devices will not work, or you should get likely to interfere with the operation medical equipments. Now we are going to search these three things. Okay. Operation medical equipments, negative near devices, safe use of hospital place. Okay, I just wrote these things. Now we will read. Okay, so just come along with me while reading. This is the instruction. Just read the heading part as well. You will get the idea what is the answer. Actually, some of the answer will be clearly in here only. So try to read that one. Instruction manual, digital automatic blood pressure monitoring. So monitor. So electromagnetic compatibility. So EMC. So they are talking about EMC of these things. Okay, try to remember that one. Now we go with the reading. With the increased use of portable electronic devices, medical equipment may be susceptible to electromagnetic interference. Because of using such electronic portable devices in our regular use may be susceptible to the electromagnetic interference. This is not related to our topic, and this may result in incorrect operation of the medical devices. Now they are talking about this one, operational, likely to interfere with the operation of other medical equipment. So other medical equipments, they are not. This may, it's similar, result in incorrect operation of medical device and create a potentially unsafe situation. This may be the answer, right? But we will wait for the moment. In order to regulate requirements for the EMC, electromagnetic compatibility, right? With the aim of preventing unsafe project situation, which they are talking about, yeah, this may result in incorrect operation. Incorrect, and then this is what is that? Operation, this may interfere. The these things and then these things. This is not related too much. This is also not related too much. Standard of level immunity electromagnetic and then this one. This is also not low. Nevertheless, this is very important. This is very important for the students. Nevertheless, however, therefore, so, but are really the distractor you need to carefully, and most of the answer in part B, the answer will be there in this section when they have mentioned about therefore in the last of the reading as well as middle of the reading text. You should try to get the answer from here. Nevertheless, nevertheless, therefore, however, but, so. These are the distractor as well as the contrasting statements. So try to nevertheless, however, and synonyms, right? However, care should be taken to avoid the use of monitor. The blood pressure monitor should be uh, taken care to avoid the use of monitor within 7 meter of the cell phone and other device generating the strong electrical magnetic field. So these three things keep in mind, and nevertheless keep in mind, as well as no, I will go with these things. Now we will go to the option wise. No need to read this all. If you are finding so many things, these are the just the irrelevant one related to your rating section. So no need to read these things. Instead, nevertheless, take strike to right. Just go with that. Nevertheless, care should be taken to avoid the use of monitor within the 7 meters of the cell phone. And this also is similar. This may result in incorrect operation. First thing is you need to eliminate negative near the device, safe use in hospital. This is not at all visible, so it is eliminated. This is eliminated, and now next wish to eliminate. This is not at all there, right? Now this is too is a confusion. So it's likely to interfere with the operation of other, but it is not likely to interfere. They are talking about this may result in incorrect, interfere and incorrect is totally different, opposite, right? So this may result in incorrect operation as well. Additional what things will it will create potentially unsafe situation. So this is not relevant to your needs. So this is not the answer. So what things is left here? B. Again, we will see whether B is a confirmation. We will confirm. Answer is may not work correctly in the close proximity. I told you close proximity is a nearby, right? So nearby, where is the nearby? 7 meter. It should be avoided. Should not use in such a meter within the 7 meter of the cell phone as well as additional devices having a strong electrical field. So it is clearly mentioned that may not work correctly in the near to the some other devices. It should not be used as well as may not work properly. So they are clearly mentioning about the B. So B is the answer. Am I correct? So am I clear to you all? So hopefully I have cleared your doubt. This is the way to tackle. When you are getting this three question, right? This three A, B, C, when you are finished with the reading, just keep in mind operational medical equipments, it is interfering as well as negative near the devices, as well as safe use hospital places. In all the hospital, it is used in all the hospital places that is not mentioned. I cannot see here, and operational medical equipment that is there, but they are clearly talking about this may. May is the again synonyms of likely, but it is the incorrect position is not there in this question. If it is interfere with the operation and of other medical equipments in the unsafe situation, then your answer is A. But since it is not there, it is clearly mentioned. Nevertheless, avoid. Avoid means may not. This is similar, right? May not, avoid, and then avoid. Avoid and may not is similar. And synonyms, okay? May not, avoid. Search the negative answer in your, and nevertheless also is there. Care should be taken to avoid use of monitor within 7 meters of the cell phone or other device generating this strong electrical field. So this is the way to tackle the answer in the part B. And we are now, I'm done with the one question. Again, I will go with the second question. Now, first is the sentence completion questionnaire, which you need to take the remaining answer from the this text. Now we got this answer is likely paraphrase, right? It may not work correctly in close proximity to some other device. So this is the answer. And now second one, second one here is what must all staff involved in transfusion process do? So this question is questionnaire only, so you need to search the answer from this option to here in this text. So when you are what must all staff involved in when they are transfusing the blood, what they need to do, what they should have, what must all staff have. So first thing is check that their existing training is still valid. Means their validation for the registration or being a nurse should be valid when they are transfusing the any of the procedure. Or not only that, part B, attend a course should be. This is again distracted. Okay, be careful with this one. A course. If it is course, they may they may write the course here, but a course is again distractor. So be careful with that. And to learn a new procedure. And C is a read a document to change the policy. So I will give you in a better version how to take a. So in your mind, you should keep these things: assessment period. Assessment period means check. Check is a always in a reading, in a speaking, as well as in the listening. I have seen many times check and assessment is going uh, together. So please, you should keep in mind that check is a paraphrase of the assess. When assessment, when you are getting such things, you will get the good score if you are able to catch this meaning. Okay, these are repeatedly coming in the exam as well as in all the modules. So please make sure not to forget this check and assessment. Okay, and assessment period and a course to learn. Number B, a course to read to change the rule. We should read a document reading to change the rules that you should keep in mind and then jump to the this here. While you're reading, write patient, write blood assessment, transfusion, right? So administration of the blood can have a significant morbidity and mortality. Procedure of the blood transfusion have the maximum morbidity and the mortality. Following introduction of right patient, right blood safety not necessary, may be competency assessed. All staff involved in the transfusion process must be competency assessed, should be checked, right? So they have clearly mentioned this again, similar, right? I told you before, check and assess the same. So we'll just put with these things, whichever possible answer assess and to ensure the safe administration of blood components to the intended patient, all staff must be aware of their responsibility in the line of professional standard. There is no one talking about reading a document, right? And staff must ensure that if they take any part in transfusion process, their competency assessment is updated. Again, competency assessment is here, right? And this is probably we have seen in the option A, and all staff are responsible for ensuring that they attend the mandatory training identified not relevant one. Relevant training courses are clearly identified, and this is also not relevant. So what we have seen is assessment period. What must all staff involved in transfusion process is clearly mentioned here again, right? All staff involved in transfusion must, this questionnaire must be competency assessed. Assess means check, assess period. A course to learn is nowhere we can see, right? So it is a wrong answer. So read to change the rules, nowhere I have seen the answer. So now what we can do is these two things we didn't find at all in this question. So are you following, right? So I'm just going with the explanation only, and please try to pause your video and try to get the explanation again. I'm sure you will get the something from my explanation. So these two things is not in the statement. What they have clearly mentioned is here must be same. They did not paraphrase. The question is same here. Process must be competency assessed. Or else, if you are not getting with this answer, check and assess. They have clearly mentioned again. Staff must ensure that if they take part in transfusion process, their competency assessment is updated every 3 years. Existing training valid. Valid is again some kind of the period. So this is the right answer. Okay, this is the right answer. Again, assessment period. Some period they may mention. Again, we got right. If you are not getting this, you are getting with this one is also correct. Okay, it is direct. It is a direct, not a applied one. So I can clearly say that everyone will get this one reading text two easily. So if you are not getting the idea, please pause your video once again and try to take the explanation from my video. And now next last is again, this is what kind of question? Yes, this is the kind of the sentence completion questionnaire. When you are getting this kind of question, what you have to do is you need to search the remaining answer, remaining completion sentence from this text. So first thing I have advised you, right? I told you to read the option first. You read this. This is for you guys. Try to take this one and comment below what is your answer. So I'm sure uh, if you are getting my explanation, you will get the right answer. If you are not getting the right answer, don't worry. I will explain you in next video as well, or else I will catch you with personally and I will teach you. I will explain you how the answer came. So the purpose of this mail is to report a rise in the surgical complication. Rise. Again, B is explaining the background to change the patient care, remind staff about the procedure for administering the drugs. So my point, always I told you right to paraphrase yourself and keep in mind and jump to the explanation. In my opinion, what paraphrasing I did is rise in the post-surgery problems, change in patient care, remind the procedure for drug administration. So, what is the topic? It is a safe use of the opioids. Opioid is a one of the narcotic drug. So, it is a mail for all the staff. So, it is clearly mentioned here in August. Alert was issued on the safe use of opioids in the hospital and reported incidents of respiratory depression among the post-surgical patient to the average of zero point 0.5. This is not necessary. Try to read, just jump to the and failure to recognize respiratory depression and institute timely intervention can lead to cardiopulmonary arrest and resulting in brain injury and death. These are not the complication, okay? Complication, they're only talking about the respiratory depression. Respiratory depression is the only problem they have mentioned here. So, a retrospective, again, these are the research words you should keep in mind. Try to learn the maximum of the research word because why I'm telling you all this is research word of maximum coming in the reading, OET reading, which may be unfamiliar with you all. So, try to retrospective is a previous study. It's an old study of the combine of many studies, like there will be including of the many studies. It is combined. That's why it's a many years back. So that is called the retrospective multi-center study. And it's not necessary as well, but just you can take the idea, retrospective study and not necessary, just go with that. And then 44% of the respiratory related and more than 35% occur in general flow. They are not talking about the post-surgical complication, right? They are just talking about complications. As complication means it's a one, so there is a more, so it is not possible, right? And then it is therefore, I told you, therefore is a restrictor. Be careful with this one. It is therefore recommended that post-operative patient now have a continuous monitoring instead of spot check of both. Spot check again is a meaning direct. It's a shortcut in a very easy way. You cannot check both the oxygen saturation level and the ventilation of the patient. Instead of that, continuous monitoring care should be um, enabled or should be started. They have mentioned, they have recommended the post-operative patient to have a continuous monitoring rather than having a spot check. That is the explanation given in this background. So I have rise of post-surgery problems. It is not mentioned. And change in patient care. I'm not very sure. And remind procedure for drug administration. Please pause the video for a while and try to get the answer and write in a comment, or else I will explain you now. So what is your answer? So what do you think? I told you before, right? Whenever there is a distractor, like nevertheless, therefore, so, thus, what are the things? However, when there is a contrasting statement changing in between in the B section, most of the answer will be in them rather than in the other part. So here also it is clearly therefore is that it is therefore the post-operative patient should have a continuous monitoring. Now is a synonym of now means they have changed. They have changed from the they earlier they are doing the spot check only. Now they want the patient to be in the continuous monitoring. So we have rise in the procedure not there. Remind the procedure of drug administration is not at all there. So change in patient care. Change of the patient care. What was done is explain the background to change. No need to read all as well. Take the maximum I told you, right? If you are taking this meaning, you will get here the paraphrase one. So it is clearly mentioned here. The patient now and the change. Now previous they were doing the instead. Previous they are doing this kind of things. Now they have changed to the continuous monitoring. Continuous monitoring. So this the purpose of the mail is to change this kind of care to the patient. So the answer is B. So the answer is B. Sorry, I have said my answer myself. So please try to pause your video and try to get the answer like this way in the part B. If you are still not clear or my explanation is stuck in between or you are having trouble, please let me know in the comment section and let me know. I will help you in the better version. And if there is any suggestion regarding my explanation, please let me know as well. And how the teaching should be done for your betterment, please let me know as well. And thank you so much um, for giving me the chance to teach part B as well, because many of the students have commented to teach part B and C, which I was not able to give you before, but I'm able to make it now. But surely, very soon I will publish the part C as well. Part C, I'd like to tell you all, if your exam is near, please don't try to read the option, because option are worse than the part B. Part B don't have doesn't have much distractor. Instead, you will get the easy answer if you read the option. But part C, if you are doing the part C, there are many distractors. If you know the option, you may end up with losing the marks. So that is my advice. But surely soon I will publish the part C. And thank you so much once again. And then this is for my today video. And part B. Part B, please make sure to know the meaning of the word in the question, especially as well as in the option. But no need to know much about the text one. But in the research word, the research word try to take maximum like a scope. Scope is a synonyms of the limitation, and then not only that, mm, the retrospective, and then what are the other things? Limitation, scope limitations. These are what are the words? Many words are there that you need to get from the get from your reading practice. And surely soon I will also get you a word of all the research things, and I will teach you guys. And then I don't have much explanation further, so I will end with this video. And all the best, and try to practice reading OET. It's not a easy one, I can tell you. But if you do the practice, you will see something in the OET reading as well as in all the modules, and you will get through easily without any trouble. So please practice more and try to discuss your answer with your friends as well, and try to discuss in this way, the way I have explained you today, and try to paraphrase all the things like here, paraphrase. And when you paraphrase this thing, then only jump to here. If you don't paraphrase this one, what you will do is you will forget this thing. And if you're reading whole this section, you will waste your time. So try to take this kind of paraphrase one and jump to the text, reading the text. So you will get the right answer at the maximum. So all the best and catch you in next video.